couple of things first. The New South Wales Deputy Premier John Barilaro and Mark Latham, to whom I'll speak later, are going to be proven right on this wretched koala issue. It now appears that farmers and private forestry landholders who are critical to the timber industry will now be excluded from these ridiculous regulations. It would be nice if people from Gladys Berejiklian and down apologised to Barilaro. She's on the record as saying these SEP maps are always wrong. Why were they released if they were wrong? I'll say something shortly about the budget, but just as I was never comfortable with the coronavirus response, I'm certainly not comfortable with this proposed spendathon. However, one good thing is we bid to become the first country in the world to publicly fund a new combination treatment for a deadly form of liver cancer, with the listing of Tecentriq and Avastin on the pharmaceutical benefit scheme for use in combination to treat patients with advanced unrectable hepatocellular carcinoma, which has become the fastest rising cause of cancer-related deaths, a terrible disease. So that's a welcome move. And I must say this, how many times do outfits like ICAC, ASIC and the ACCC go after tall poppies? Nearly 2 years ago, a very good man, Peter Gregg, the boss of primary health care, formerly Chief Financial Officer of Leighton, was found guilty of falsifying Leighton's books back in 2011. For those who know Peter Gregg, it was never credible. But he was found guilty and sentenced to 12 months home detention. Last week, the New South Wales Court of Criminal Appeal dismissed the ruling, calling it a, quote, substantial miscarriage of justice. Indeed, the New South Wales Chief Justice Tom Bathurst said the prosecutor's closing address to the jury was unbalanced, unfair, and to a significant extent reversed the onus of proof. But of course, in our system of justice, if you or I are found to get something wrong, the book's thrown at us. If those supposedly administering justice are wrong, nothing happens. Peter Gregg's a fine human being. As a result of this substantial miscarriage of justice, a man's reputation is damaged, his marriage collapses, he faces severe depression and couldn't even secure a credit card. If that's what's called justice, we should start again. And voters in the French South Pacific territory of New Caledonia last night narrowly rejected breaking away from France after almost 170 years. 53% of New Caledonia's 284,000 population rejected breaking away from France. I'll tell you something, it is a beautiful part of the world. And just to drive the alarmist nuts, there are 6 critical cases of coronavirus in Australia. 6. There are 40 people in hospital, 28 in Victoria, 12 in the rest of the country. Can someone please let us get on with our lives? This isn't and wasn't a pandemic. I'm not going to bore you with all this, but I must emphasise that the alarmism continues. In the wake of Donald Trump testing positive, and I'll come to that later in terms of what it means for the election, the Trump positive test, along with others at the White House, extends the hysteria and the alarmism. Reality out the window, fear is welcome. But there are so far in America, from or with coronavirus, they're all dumped in together, 215,000 deaths. That represents 0.065% of the population. The total deaths in the world this year from communicable disease are 9.9 million. Coronavirus, 1.04. Some estimates say that fewer than 10% have died from coronavirus alone. Last week on our Wednesday Mail panel, Chris Minns, fairly smart cookie, kept on referring to France. I am trying to dismantle the alarmism so that people and business can get on with their lives. Or as I've said, give us our lives back. Let the bulk of the people look after their own health, and we, as we always should, look after the elderly and the vulnerable. France has a population of 67 million. 674,000 have tested positive. That's 0.84% of the population. But 32,000 have died. That's 0.047% of the French population. I don't think that is a pandemic. Then we have a story from the Herald Sun in Melbourne today that the accuracy of the Victorian death toll is being brought into question. Following allegations, government officials attributed deaths to COVID, even when doctors couldn't verify a cause. The Herald Sun cites internal correspondence from the Glenferrie Private Hospital Chief Executive Julia Morgan on August 7, shortly after the hospital received a transfer of ill elderly residents from St Basil's Home of the Aged. And the correspondent said, and I quote, "As you are aware, 9 aged care patients were admitted to Glenferrie on July 27. Sadly, 4 of these patients have since passed away. we are unable to verify the exact cause of their death, but the state has attributed the deaths to COVID-19. And cop this, the Department of Health and Human Services has confirmed that in Victoria, quote, all deaths with a positive coronavirus diagnosis are included in the state's toll, regardless of whether it was the overarching cause of death. And what about this? Quote, this reporting is consistent across all states and territories to ensure the figures are comparable across the country, unquote. In other words, we don't know whether they died from coronavirus or just died with it, but ramp up the stats to confirm the legitimacy of the alarmism. And this, we're told, is consistent with the Communicable Diseases Network Australia guidelines applied across the country. Melbourne GPs say, understandably, the reporting is not accurate. One doctor has said, quote, the only way to determine the cause of death is with a post-mortem. But the deceased are either cremated or buried straight away, and it's not possible to say with certainty they died from COVID-19 or with COVID-19. The Camberwell doctor, Dr Jeff Wells, said what I've been saying for months, quote, the government is using this data to enhance the lockdown policy and it is not accurate. Another doctor said the Victorian government is basing its coronavirus strategy on deaths and case numbers. From my experience in the nursing home, those dying with coronavirus would greatly exceed those dying from coronavirus. We have been saddled with hoaxes for years on various modelling issues. Are these figures another hoax? You might remember way back in March, I referred to Professor John Ioannidis, the Professor of Epidemiology at Stanford University, and he said, and I quote, if we'd not known about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. The media coverage would have been less than for an NBA game between the two most indifferent teams, unquote. What do you make of all that? Have we been led by the nose with numbers just to justify the alarmism? I'd love to hear your views. Email alan@skynews.com.au or the text line is 0414 000 848. I have called for a national advertising campaign to tell Australians the truth. 99% of cases are mild. If we've got a Royal Commission into Aged Care because of the failure of the coronavirus response to deal with the most vulnerable, why shouldn't there be a Royal Commission into the response where the real experts were ignored and trumped-up experts like poorly qualified chief medical officers have ruled our lives? And now tomorrow, we'll have chilling proof of where this advice to shut down the private sector has taken us. Politicians have now buried us in an economic hole so deep we may never be able to get out. We're told a Liberal government will now spend whatever it takes. $1 billion here, $10 billion there, a one-year deficit north of $200 billion. Abandon all restraint. Just as we're not told when these absurd restrictions as a result of coronavirus will end, can someone tell us when a halt will be put to this absurd spending? When the Menzies government took office in December 1949, the debt unbelievably was far worse than what we face today. If you can get your head around it, 120% of GDP. Today we're about 50% of GDP. Menzies, 120%. Menzies rejected countless proposals to boost social spending. He emphasised the need for unceasing expenditure restraint. But in this budget tomorrow, far from getting out of the way, the government will take further control of our lives, inviting people to put their hand out, abandoning the truth that enduring prosperity can only be based on individual initiative and self-reliance. This is a Liberal government in name only. Menzies argued that the first impulse of a Liberal government in times like these for Menzies after the war should always be, and I quote his words, quote, to seek the private enterprise answer, to help the individual help himself, to create a climate, economic, social and industrial, favourable to his activity and growth, unquote. I think Morrison, Frydenberg and co need to go back and do a bit of reading of history.